Thank you, Nima, and thanks everyone for joining today. It's really my pleasure to be able to present the work that's underpinned this policy brief and talk a little bit about the recommendations. I did just want to start by acknowledging the traditional custodians of the lands from which we're all joining this webinar today. For me, in sunny central Sydney, it's the Gadigal people of the Eora Nation, and just to pay my respects to elders past and present. So today we'll be talking about the policy brief, Strengthening the Health System Response to Population Ageing in Pacific Island Countries. I'd really love to acknowledge the co-authors on this brief, Dr. Selena Motafunga and Dr. Amarita Ravuvu from the Pacific Community, Dr. Meiling Perman from Fiji National University, who's joining our panel today, and Dr. Adam Craig from University of Queensland. And just to very much thank and acknowledge the Asia Pacific Observatory on Health Systems and Policies for the support in producing this brief. Also to importantly acknowledge project partners, and you'll hear in a minute about the setting for the research underpinning this work, but we worked closely with the Fiji Ministry of Health and Medical Services, the Department of Health and Social Affairs in the Federated States of Micronesia, as well as the Ministry of Health in the Kingdom of Tonga. So a huge thanks to the partners in each of those settings, as well as the research teams who had the very important role of gathering the evidence underpinning this work. So in approaching the formulation of this policy brief, we really had two key aims: to inform priorities for developing older person-centred and integrated healthcare services across the Pacific Island region, and to look at the policy question of how can Pacific Island country health systems really be effectively strengthened to achieve universal health coverage for older populations. In doing this, we had a couple of expected outcomes. One was to produce some evidence-based guidance for national healthy ageing policy strategy and services, particularly for the 4 settings in which our research component took place. And then secondly, to produce this regional policy brief to present that evidence to support recommendations on healthy ageing policy and intervention priorities for Pacific Island health decision makers to really consider. So we used a 3-component methodology to gather the evidence behind this policy brief, and our data was collected from all the way back in June 2019 through to April last year. The primary research component, as I mentioned, was conducted in 4 country settings: in Tonga, in Fiji, in FSM, and in Vanuatu. And we pulled together each of the findings from these 4 countries to really compare and identify common, contrasting and complementary themes. The 3 components of the work included, firstly, taking publicly available, accessible data to generate a snapshot of ageing and health. Some of this data included administrative data from health systems, from national survey reports, data produced by the Global Burden of Diseases study, for example, was very important in this. But we pulled this together to just try and collate a pretty clear picture of some of the key health and social care issues being faced by older populations in the region. The second component, we looked at mapping healthy ageing policies, strategies and plans throughout each of the 4 countries, just to get a picture and overview of how countries are currently addressing population ageing through their policy environment. And we mapped these policies to the World Health Organization's regional action plan on healthy ageing in the Western Pacific, and the 5 objectives of that action plan, which I'll talk to briefly in a minute. And the third, and I think the most important component of this work, was to evaluate user perspectives on priority health system responses to ageing. And when I say user, I mean older adults themselves, caregivers and families, as well as those providing services, healthcare workers, government and non-government services targeted to older populations, and policymakers themselves. We really wanted to evaluate the acceptability of current health system responses, as well as, what needs to happen in the future, and, what particularly older people and caregivers want and need to be able to age healthily. So this is the analytical framework I mentioned previously. You may be aware this is the Regional Action Plan on Healthy Aging in the Western Pacific, published in 2020, and it really underpins the UN Decade of Healthy Aging, which runs through to 2030. And we use those 5 objectives there to map out aging policy environment in particular, just to identify where the strengths exist and where some of the gaps. So some background to aging or population aging globally first, and then we'll hone in on the Pacific. So we're probably mostly all aware that back in 2015 through to 2050, the proportion of the world's population over 60 years of age will nearly double from 12% to 22%. You can see there that trajectory is rising rapidly through to 2050 and then beyond. We can also see that the trajectory for the older age group, those 60 years and over, is increasing at a much, much faster rate compared to the population age groups of a lower age. And we've seen just a few years ago is the first time in the history of the world where the population over 65 was a higher number than the population under the age of 5 years. So why is this happening? We've got declining fertility rates. We know that advances in public health, in medicine, mean that people are living longer, and that's fantastic. We've seen women are living longer than men, but the real question that remains is that are the later years in life now spent in good health? And there's actually no clear evidence that older people today are living out their later years in life in any better health state than those in generations before them. So aging in the Pacific, we're actually going to see that by 2050, some of the populations aged 60 years and above will almost treble. With that increasing growth, we're seeing an increase in non-communicable diseases, multi-morbidity, so having multiple chronic conditions at the one time, and then disability that's linked to age-related declines in mobility, in sensory function, and in cognitive function. We know that the majority of older persons in the Pacific, like elsewhere, are going to be women. And in fact, 60% of the oldest old, and that's a term that's used to coin those who are 85 years and above, will be women. And we also know that in the Pacific, the health systems have been historically geared towards a young population, and they remain challenged by the management of chronic conditions, by aspects of integration and supporting continuity of care, and it also largely lack a coordinated approach to palliative or end-of-life care. Because very little to date has been done on this issue of population ageing in Pacific Island countries, governments in the region are really hindered by a lack of knowledge of what is needed and what works for the care of older persons in their context. So here's just a few figures from the UNFPA that shows the growth of the ageing population in Pacific Island countries. It's occurring in different rates throughout the region, most rapidly in small countries of Polynesia and Micronesia, and much more slowly in Melanesia, with the exception of Fiji, which is one of the most populous Pacific Island countries. In terms of numbers, you might look at that and think, well, that's a small number if you're coming from some of the more populous countries, for example, here in Australia. But even these numbers in already stretched health systems and small populations are going to have a significant impact, not only on the delivery of care, but the ability of people to access the care that they need and be able to really achieve the quality of life that they deserve as they become older. One of the other important statistics, I guess, to note is the concept of the potential support ratio. And that's the number of persons who are really potentially economically active in that age range of 15 to 64 years who are available to essentially care for people aged 65 years and above. And that lower the support ratio, the fewer people there are, and that really places an economic stress on families and on countries themselves. And you can see across all of the Pacific countries that potential support ratio is dropping over the next decade and on to 2050. What does that mean for health systems, though? So we've seen the changing health profile. There's an increasing prevalence of non-communicable diseases, multi-morbidity, disability. These together create an increased demand for health services. And in addition, it's more expensive health services. So we know that lifelong treatment for chronic diseases is much more expensive than some of the treatment for communicable diseases. Other aspects to consider within the health system around human resources for health, service delivery models for an ageing population, aspects of social protection, burden on households, whether that be financial or other, and also the concept of multidimensional poverty. So we know that older people in rural communities, for example, are more likely to suffer hardship than their urban counterparts. We also know that women within those groups are disproportionately affected. So I'd like to just quickly run through what we found in creating this policy brief. And in 3 sections, the first is that ageing and health snapshot, looking at the policy environment in the second section, and then thirdly, the user perspectives. So here's some key statistics that we pulled together, and you'll find them in the policy brief themselves. We present these for each of the 4 countries that was involved in this policy brief. You can see that the proportion of the total population aged 60 years and above is still relatively small, but this will increase over the coming decades. A few things to highlight here. In Fiji in particular here, this concept of the healthy life expectancy at birth. So this is the number of years that people can expect to live in good health. Despite have a life expectancy of up to 67 years, the healthy life expectancy there is 58.7 years for women and 56.7 for men. You'll also note in Tonga there the increasing or the greater proportion of older people living in rural areas, and we see this throughout the region. Rurality is quite hard to define in the Pacific, but basically any of those areas outside the urban city, often just the capital city of the country, as well as some of the maritime and island communities. Similarly, in Vanuatu and FSM, small proportion currently of the population aged 65 years and above, but again, high proportion living in rural areas. Healthy life expectancy quite young, 59 years in FSM. And in Vanuatu, to note in particular, that age dependency ratio I spoke of earlier is very high in this case, which again means that there's a much higher proportion of older people who are reliant on those who are currently economically active. In terms of morbidity and mortality, unsurprisingly, again, chronic disease, non-communicable disease is the greatest cause of death and disability among the older age groups throughout the region. Cardiovascular diseases remains a leading cause of death, type 2 diabetes as well, and responsible for almost up to 80% in some countries of deaths. We looked briefly at current social protection and long-term care models. Across each of the countries, these consisted of most strongly informal arrangements, which focus on extended families and kin. Contributory retirement schemes, so these were for formal sector workers only, and also non-contributory social security schemes or old age pensions, which are present in Tonga, Fiji, and Federated States of Micronesia. There's also cash transfer programs and food security programs in a couple of the countries, as well as a disability pension in Micronesia for those who are insured. Tonga provides one of the only examples of a national home care program, which is run by a non-government organisation with support from the government, and they provide home care services to a limited number of older persons. So the extended family is really traditionally the support network for frail older persons, but also for dependent children. And we saw through our work this increasing reliance on intergenerational care. So a lot of grandparents caring for their grandchildren at home, while the grandparents' children themselves are off elsewhere for employment or education. And we also saw that there has been an erosion of some of these traditional social protection structures, and this has largely been precipitated by outmigration, so people leaving their communities either to the capital city of the country for education and work, or internationally for education and work, leaving behind the families. And this really heightens that need for formalised social protection strategies and long-term care initiatives. The second component of our work, we were looking at the policy environment across each of the 4 countries, specifically in relation to healthy ageing. We reviewed 66 policy documents across the 4 countries and found that most of the objectives set out by that WHO Regional Action Plan on Healthy Ageing were only partially reflected by policy or strategy. And there's an example there of how this is presented in the policy brief itself, how we've sort of mapped out where nations were addressing these objectives through that policy environment. None of the 4 countries had current comprehensive national ageing policy frameworks, but every country did have at least one overarching policy document that explicitly mentioned older adults. For many of the countries, that was their strategic development plans or frameworks. In Vanuatu, their national health sector strategy also mentioned older people specifically. So what were some of the shortfalls in the policy environment that we could identify? Firstly, the absence of even the word older adults. So the policies themselves rarely address specific needs of older people and often grouped them more broadly with vulnerable populations. There's very limited attention in policy to integrate health with social care services, which would obviously lead to a fragmented response to older people's needs. Limited mention or strategy around workforce training, particularly around specialisation in geriatrics or long-term care, as well as that limited linkage between national policies. So non-communicable diseases is separate to disability, is separate to social protection. We saw that the monitoring frameworks attached to policies or strategy really lacked ageing-specific indicators, which would make it very difficult for countries to really track how they're progressing in support of population ageing. And there are also no policy commitments at this point in time around understanding what the implications of population ageing could be, in addition to what technological and social innovation might be put in place to support older adults and their caregivers. There were, however, strengths, and I do want to focus on these. So across all of the countries, there's still a range of national policy documents that do indirectly recognise or address the strategic objectives of that Regional Action Plan on Healthy Ageing. In Fiji, although their national policy of ageing lapsed in 2016, it was really a prime example how a policy could align health systems to older adult needs. And it also recognised the gender dimensions, which was quite progressive back at the time of when it was produced. That policy also established what's called the National Council of Older Persons in Fiji, which is a multi-sectoral body that provides ongoing cross-government coordination on ageing. Our policy review found community health workers and primary healthcare providers played a really important role in service delivery, and they do offer an entry point for integrating ageing services. And we also found that national health plans in particular demonstrated a commitment to health system strengthening and health system development, which can provide leverage to incorporate ageing specific services. So all in all, the existing national policy frameworks in each of the 4 countries do provide a strong leverage point from which to build national responses to healthy ageing. So the third component I'm touching on here is evaluating the community and provider perspectives on ageing and the ability to health services to meet the needs of an ageing population both now and into the future. We approached this through qualitative work, so we conducted focus group discussions with older adults and caregivers in 3 of the 4 countries, as well as with government and non-government interest holders. You'll see there the breakdown of the discussions that were had over the course of the research. I just want to touch on some of the overarching themes that came out of that qualitative work. So from the community, so older persons and caregivers, we saw a prevalent sense of respect for and recognition of the importance of older people within society. At the same time, however, we did identify that ageism and disrespect was experienced by older people in some settings, and this came out in Fiji and Tonga in particular. We found that older people reported that their declining health and perceived loss of capability really inhibited their participation, and that they were very keen to remain active and to retain their agency and participation as they got older. The work highlighted again that primary healthcare services are the first point of call for older adults. However, still the cost of transport and medicines remain a barrier to accessing care. There's long wait times at hospital clinics, primary care clinics, and inadequate resources, particularly at facility-based care for the needs of older adults. We found also that healthcare worker availability, as well as their skills, including communication skills, were perceived as inadequate to meet the needs of older adults. And just generally, there were a lack of services that were targeted specifically to older people. Basic safe water and sanitation still remained lacking in areas of Federated States of Micronesia where we spoke to communities. And we also found a pretty prevalent sentiment that the government social security benefits that were available, when accessible, they were still inadequate really to cover even costs of basic living costs. Importantly, and this is reinforced throughout the whole program of work here, family are the primary caregivers of older adults in Pacific Island countries. They identified a need for more support, more training, and more resources, particularly for those informal caregivers to be able to provide best care for their family member. We also found that caring responsibilities negatively impact the mental health of carers and also their ability to earn an income due to their requirement of really, staying in the home environment to care for relatives. Through the discussions with government decision makers and health workers, as well as non-government agencies providing programs for older adults, these stakeholders identified inadequate health infrastructure to optimise the care of older adults, particularly the physical environment, so clinics, roads, really not age or disability friendly. There's an inadequate number of appropriately trained healthcare workers and also a lack of specifically tailored programs and services for older adults. Again, these groups of people identified that need to provide training and support for informal caregivers. They thought there was a need to strengthen public awareness of healthy ageing, as well as the services that are currently available to support older adults and their family. And they also felt that there was still an untapped potential to harness both existing data as well as gather new evidence to inform context-appropriate programs and services for older adults and their caregivers. Based on this information and through our work with the policymakers in each of those 4 countries, we put together a set of recommended actions for Pacific Island countries to consider when it comes to population ageing. Being from a research environment myself, we also couldn't help but identify some additional evidence priorities for people to consider as we move forward. So we've got 8 recommendations, which I'll talk through briefly. The first being a need to coordinate national and regional advocacy efforts to raise the priority of ageing issues, both for government and non-government interest holders. The second recommendation, very important, empowering family and informal caregivers as the key providers of long-term care for older adults. There's a need there, recommendation 3, to strengthen infrastructure and resources for health and social care. And then recommendation 4 also goes back to that burden of chronic disease. Really strengthening community-based models of primary health care for older adults is critical, with a focus on preventing and managing some of those non-communicable diseases that are the most prevailing causes of death and disability. It needs recommendation 5 to prioritise financing and funding of healthy ageing initiatives, including supporting caregivers. Recommendation 6, strengthening community-centred initiatives, and these could be designed to maintain the participation and the agency of older adults within the community. Recommendation 7 is around strengthening health information systems, really to provide disaggregated data to support the design of equitable health programs. At the moment, many of the health services do not have health information systems that can quickly produce disaggregated data for us to be able to identify those with greatest needs and what those needs might be. And then finally, recommendation 8 is to consider a standardised approach to the collection of data related to healthy ageing and really ensuring adoption of a regionally harmonised instrument for the measurement of a disability, which is something that's currently lacking. And in terms of additional evidence, I might leave these up here without talking through them directly, but really research priorities that will help with the design of services and care models, and also inform decision-making around healthy ageing policy, as well as policy implementation strategies. So just to finish off, just some additional acknowledgements. A small team at the George Institute and UNSW Sydney who really supported some of the data collation and analyses, but most importantly, just wanted to thank the older adults, caregivers, health workers, government officials and non-government partners who really generously gave their time to share their thoughts and experience for this work. Thank you.